News this morning, burn trauma can cause psychological distress in most survivors of severe burn injuries, as well as for family members and their friends. Amy Spencer, who is a MD with Spectrum Health critical care surgeon, and then Amy Acton, a burn survivor actually, and Phoenix Society executive director, both here to talk about burn trauma and the upcoming Phoenix Society World Burn Congress 2016. Thank you so much for being here with us, ladies.
Thank you for having us.
Absolutely. Now, burn trauma, that's something really that's not discussed a lot. We always hear different degrees of the burns, but what exactly is burn trauma?
So burn trauma is something that can happen from either thermal, chemical, or electrical injuries, and it usually leads to either first, second, or third degree burns. The first degree burns that we see are generally very superficial burns. They're painful, they're red, but they don't have any blistering. When you get down to the second degree burns, it's gone through the epidermis and a portion of the dermis, and it leads to painful red burns that then blister. When you get to the third degree burns, those are deeper and they can even reach down to muscle and tendon and bone, and they've gone all the way through the dermis and they've actually burned the nerves as well, so those are not painful. Those may look white or charred.
Okay, and obviously depending on the degree of the burn, the treatment for these varies, correct? What do these patients go through?
So it can be anything from very simple, just dressings like triple antibiotic ointment or Silvadene, to the point of where they may need to have that burn wound excised and then skin grafts afterwards. So they go through a lot of complex rehabilitation in the hospital, where we talk about nutritional care, emotional care, and then we also talk about having their burns treated that can sometimes take months, even going through complex reconstruction for cosmetic purposes.
Absolutely. And Amy, you know all too well what this is like. What is your story?
Well, I was burned when I was 18 at a yacht club I worked at. I hit a high tension wire with a sailboat mast, so my burn was an electrical injury.
Oh my goodness. Yeah. So over what percentage of your body are you burned?
About 20% of my body. Most of it is hidden burn.
Yeah. So what was that like? I mean, do you remember that day? Is it something that your memory kind of has lapsed over, or?
Fortunately, I'm one of the ones that don't remember. I don't remember the day at all, but many do. And so, you know, my memories are more about the care I received at Spectrum Health's Burn Center, which was fabulous. And I think the long-term recovery piece is what I've been focused on my whole career, realizing that medical care has advanced so quickly. We're surviving most of the time now when we're admitted into burn centers. So we're really focusing on that long-term care.
Yeah, and you've actually spun this into a positive by actually uniting a bunch of other burn victims, correct? What is your role now?
Well, I'm the executive director of the Phoenix Society for Burn Survivors, which is a national organization based right here in Grand Rapids, Michigan. We've been around, though, for 40 years. And we really focus on that peer support aspect. Knowing somebody that's had a burn injury is really critical when you're new, because you go home and you probably have never met another burn survivor before. So when you see somebody that's ahead of you on the road to recovery, it gives you hope. Yeah. So that's what we're all about, is connecting people, helping them see the positive outcomes that can occur.
Yeah, and there's an upcoming gathering that's going to take place. What is that called, and then who will take part in this?
Yeah, it's called World Burn Congress, and it's been happening for, I think this is our 28th year. And it's a gathering of survivors, healthcare professionals, and the fire service. And we really focus on the long-term recovery. Everything from relationships and how they're impacted by trauma, to social skills, how to answer the questions and stares that you may receive because you look different. So that is happening in Rhode Island. And this year, because access is so hard for people to get these resources, we're going to be live streaming to Spectrum Health at Fred and Lena Meyer Heart Center for the day.
Sure. Is this something that's open to people that are watching right now that would like to take part, or is it, are the seats already full?
Yes, it's open, it's free. It starts at 9 o'clock on Friday, and it will be streaming live from Rhode Island to Spectrum Health and talking with each other. And it's a way that we're really looking to advance access for survivors across the country and the world eventually, we hope.
I'm sure you went through every bit of emotion, didn't you? You probably felt a little sorry for yourself, you know, that sort of thing. So, I love the fact that you've moved on and done something positive with what's happened to you.
Yeah, there's a whole community of peer supporters. We have the Burn Center here has our program. It's called SOAR, Survivors Offering Assistance and Recovery. And those are trained survivors that come back to the hospital and help other survivors and family members recover.
Yeah. Interesting stuff. Well, thank you so much. I want to make sure we get the information back out there for everybody that we just talked about. So the Phoenix World Burn Congress, once again, live streaming event Friday, October 21st, 9 a.m. to 3:30 p.m. at the Fred and Lena Meyer Hart Center, 100 Michigan Street Northeast, 8th floor, room 8811. Free, open to the public. To learn more, go to phoenixsociety.org/WBC streaming. Thank you very much for stopping by, ladies.
Thank you.
Absolutely. Coming up, also, I'm sorry, if you'd like to contact the Phoenix Society for Burn Survivors, this is very important. You should call them, 1-800-888-2876. We'll make sure to get this on our website and Facebook page after.